Question 1. Compliance review shows that an EKG technician is evaluating a tracing and notes ST segment deviations in leads V1, V4. Which of the following comparative analyses of coronary circulation best guides the technician's interpretation of these findings? Option A. Interpreting the ST segment deviations in V1, V4 as a normal variant without further investigation into coronary artery perfusion. Option B. Focusing on the ST segment deviations in V1, V4 as indicative of an inferior wall myocardial infarction, as this is a common presentation. Option C. Assessing the ST segment deviations in V1, V4 and attributing them solely to generalized myocardial strain without considering specific arterial supply. Option D. Correlating the ST segment deviations in V1, V4 with the anterior and septal walls of the left ventricle, which are primarily supplied by the left anterior descending artery. The correct answer is D. Correlating the ST segment deviations in V1, V4 with the anterior and septal walls of the left ventricle, which are primarily supplied by the left anterior descending artery. Explanation. Scenario analysis. This scenario is professionally challenging because it requires an EKG technician to differentiate between normal physiological variations in coronary circulation and potential pathological findings, directly impacting patient diagnosis and treatment. Misinterpreting these subtle differences can lead to delayed or incorrect medical interventions, posing a significant risk to patient well-being. The technician must possess a deep understanding of coronary anatomy and physiology, as well as the ability to correlate EKG findings with these underlying structures and their blood supply. Correct approach analysis. The correct approach involves a comparative analysis of the EKG tracing against established knowledge of coronary artery territories and their typical EKG manifestations. This aligns with the Certified EKG Technician certification's emphasis on accurate interpretation and understanding of the relationship between cardiac electrical activity and underlying myocardial perfusion. Best professional practice dictates that the technician should identify specific EKG leads and their corresponding coronary artery supply, e.g., anterior wall supplied by LAD, inferior wall by RCA/LCX, and then assess for characteristic changes, ST elevation/depression, T-wave inversions, that would indicate ischemia or infarction within those territories. This systematic, knowledge-based approach ensures that findings are interpreted within the context of coronary anatomy, leading to more precise reporting and facilitating timely physician diagnosis. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of any ST segment deviation without considering the specific leads involved and their coronary artery territories. This is a regulatory failure, as it bypasses the core competency of relating EKG findings to coronary circulation, a fundamental requirement for the certification. It is ethically problematic as it risks misattributing findings, potentially leading to a misdiagnosis of a critical coronary event. Another incorrect approach would be to assume all ST segment changes are indicative of acute myocardial infarction without further differentiation. This fails to acknowledge that other conditions can cause ST segment abnormalities and neglects the crucial step of correlating these changes with specific coronary artery territories. This represents a failure to adhere to the detailed diagnostic protocols expected of a certified technician and is ethically unsound due to the potential for alarm and unnecessary intervention. A third incorrect approach would be to disregard subtle T-wave abnormalities in leads that typically reflect posterior or septal circulation, focusing only on more prominent changes in anterior or inferior leads. This is a failure to apply a comprehensive understanding of coronary circulation, as even subtle changes in less commonly emphasized territories can be significant. Ethically, this approach is deficient because it overlooks potential indicators of disease in vital areas of the heart. Professional reasoning. Professionals should approach EKG interpretation by first identifying the leads and then systematically correlating them with their respective coronary artery territories. They should then analyze the specific EKG waveforms, P waves, QRS complexes, ST segments, T waves, for deviations from normal within those territories. This comparative analysis, grounded in anatomical and physiological knowledge, allows for accurate identification of potential ischemic or infarcted areas. When faced with ambiguous findings, The professional decision-making process involves consulting established EKG interpretation guidelines, reviewing patient history, and escalating concerns to a qualified physician for definitive diagnosis and management. Question 2. The assessment process reveals that a patient's EKG tracing is consistently showing artifact and an irregular baseline, despite multiple attempts to obtain a clear tracing. The certified EKG technician needs to determine the most effective initial course of action to rectify the situation. Option A. Systematically check lead placement and adhesion, ensure proper patient grounding and stillness, and verify the integrity of lead wires and electrodes before considering internal machine diagnostics or calibration. Option B. Immediately initiate a full diagnostic calibration sequence on the EKG machine to recalibrate its internal sensors and signal processing units. Option C. Replace the EKG machine with a backup unit without performing any preliminary checks on the current machine's setup or components. Option D. Focus solely on adjusting the gain and filter settings on the EKG machine to minimize the visual appearance of artifact on the tracing. Correct answer is A. Systematically check lead placement and adhesion, ensure proper patient grounding and stillness, and verify the integrity of lead wires and electrodes before considering internal machine diagnostics or calibration. Explanation. Scenario analysis. This scenario presents a common challenge in a clinical setting where a certified EKG technician must ensure the proper functioning and calibration of essential diagnostic equipment. Challenge lies in identifying the root cause of an EKG machine's inconsistent readings, which could stem from various components. Incorrectly diagnosing the issue can lead to delayed or inaccurate patient care, potentially impacting diagnosis and treatment. The technician's responsibility is to apply their knowledge of EKG machine components and their functions to systematically troubleshoot the problem, adhering to established protocols and manufacturer guidelines. Correct approach analysis. The correct approach involves a systematic evaluation of the EKG machine's components, starting with the most common or easily verifiable issues. This includes checking lead placement and connection integrity, ensuring the patient is properly prepared and still, and verifying the machine's power source and grounding. If these basic checks do not resolve the inconsistency, the next step is to examine the EKG paper or digital display for artifacts, which can indicate issues with the electrodes, lead wires, or the machine's internal circuitry. Finally, a calibration check confirms the machine's accuracy in measuring electrical signals. This methodical process aligns with best professional practices by prioritizing patient safety and diagnostic accuracy, minimizing the risk of misinterpretation due to equipment malfunction. It also implicitly follows manufacturer guidelines and general healthcare standards for equipment maintenance and use, ensuring the reliability of the diagnostic data. Incorrect approaches analysis. One incorrect approach is to immediately assume a major internal component failure without first performing basic troubleshooting steps. This is inefficient and can lead to unnecessary service calls or machine downtime. It bypasses fundamental checks that are often the cause of EKG signal irregularities, such as loose leads or patient movement. Another incorrect approach is to solely focus on the EKG paper or digital display output without investigating the source of the signal. This is akin to treating a symptom without addressing the underlying cause. The display is a representation of the electrical activity. If the signal acquisition is flawed, the display will be too. Furthermore, neglecting to check the patient preparation and lead placement is a significant ethical and professional lapse, as these are critical factors influencing EKG quality and are within the technician's direct control. Professional reasoning. When faced with inconsistent EKG readings, a certified EKG technician should employ a structured problem-solving approach. This begins with a thorough review of the patient's preparation and the integrity of the lead connections. Next, assess for external factors that could cause artifacts, such as patient movement or electrical interference. If these are ruled out, then systematically examine the EKG machine's components, starting with consumables like electrodes and lead wires, progressing to the machine's internal settings and calibration. Documenting each step taken and the findings is crucial for continuity of care and for future troubleshooting. Adherence to manufacturer manuals and institutional policies for equipment maintenance and troubleshooting is paramount. Question 3. Implementation of an EKG on a patient reveals a regular rhythm with a heart rate of 70 beats per minute. However, the technician observes that the P waves appear to be originating from different locations within the atria, exhibiting varying morphologies, and the PR interval is consistently prolonged at 0.24 seconds, based on your understanding of the anatomy and physiology of the cardiovascular system. Which of the following represents the most appropriate initial interpretation and action for the EKG technician? Option A. Recognize that the varying P-wave morphologies and prolonged PR interval suggest an abnormal atrial rhythm or conduction delay, necessitating detailed documentation and prompt reporting to the supervising physician for further evaluation. Option B. Conclude that the prolonged PR interval is a normal variation in this patient, and that the varying P-wave morphologies are likely due to slight changes in lead placement during the procedure. Option C. Assume that the observed P waves are all originating from the sinoatrial node, and the prolonged PR interval is a common artifact that can be ignored. Option D. Focus solely on the regular rhythm and heart rate of 70 BPM, as these are within normal limits, and disregard the observed P wave abnormalities and PR interval. The correct answer is A. Recognize that the varying P-wave morphologies and prolonged PR interval suggest an abnormal atrial rhythm or conduction delay, necessitating detailed documentation and prompt reporting to the supervising physician for further evaluation. Explanation. Scenario analysis. This scenario presents a common challenge for EKG technicians, interpreting subtle physiological changes that could indicate a serious underlying cardiac issue. The technician must rely on their understanding of cardiac anatomy and physiology to differentiate between normal variations and potentially pathological findings. The professional challenge lies in the potential for misinterpretation, which could lead to delayed or incorrect treatment, impacting patient outcomes. Accurate assessment requires a thorough understanding of how the heart's structure and function influence electrical activity. Correct approach analysis. The correct approach involves recognizing that the described changes, particularly the altered P-wave morphology and prolonged PR interval, are not typical for a healthy sinoatrial SA node originating rhythm. This understanding stems directly from the anatomy and physiology of the cardiovascular system. The SA node, located in the right atrium, is the heart's natural pacemaker, initiating the electrical impulse. The P-wave on an EKG represents atrial depolarization, originating from the SA node. A prolonged PR interval signifies a delay in conduction through the atrioventricular AV node. Therefore, identifying these deviations prompts further investigation to determine if the impulse is originating from an abnormal site or if there is a conduction block, which is best professional practice, and aligns with the technician's scope of practice to accurately report findings for physician interpretation. Incorrect approach is analysis. Dismissing the findings as insignificant or attributing them solely to patient positioning fails to acknowledge the potential for underlying cardiac dysfunction. Regulatory frameworks for EKG technicians emphasize accurate data collection and reporting. Ignoring or downplaying abnormal EKG findings constitutes a failure to adhere to these standards, potentially leading to a breach of professional duty. Attributing the changes to artifacts without a systematic troubleshooting process also violates best practices. Technicians are expected to differentiate between true physiological signals and interference, and a methodical approach to artifact identification is crucial. Misinterpreting the origin of the electrical impulse, for example, by assuming all P waves originate from the SA node regardless of morphology, demonstrates a fundamental misunderstanding of cardiac electrophysiology and would lead to inaccurate reporting, a direct violation of professional responsibility. Professional reasoning. Professionals should approach EKG interpretation by systematically evaluating each component of the EKG tracing. This includes assessing the rate, rhythm, P-wave morphology, and relationship to the QRS complex, PR interval, QRS duration, and ST segment. When deviations from normal are observed, the technician must correlate these findings with their knowledge of cardiac anatomy and physiology to hypothesize potential causes. Decision-making process should involve comparing the observed EKG characteristics to known patterns of electrical conduction and potential abnormalities. If the findings are concerning or cannot be definitively explained by normal physiological variations or common artifacts, the technician's responsibility is to document these findings accurately and report them to the supervising physician or qualified healthcare provider for further diagnosis and management. This ensures patient safety and adherence to regulatory requirements for accurate diagnostic testing. Question 4. Cost-benefit analysis shows that implementing a standardized, comprehensive EKG procedure that prioritizes accurate data acquisition over rapid completion can lead to a reduction in repeat testing and improved diagnostic yield, thereby enhancing patient outcomes. Considering this, what is the primary purpose of electrocardiography as understood within the regulatory framework for certified EKG technicians? Option A. Provide a quick and inexpensive method for screening a large number of patients for general health status. Option B. To record the electrical activity of the heart for the purpose of diagnosing and monitoring cardiac conditions. Option C. To generate a visual representation of the heart's mechanical pumping action for educational purposes. Option D. To serve as a preliminary step in the billing process for cardiac-related diagnostic services. The correct answer is B. To record the electrical activity of the heart for the purpose of diagnosing and monitoring cardiac conditions. Explanation. The scenario presents a common challenge in healthcare settings, balancing the need for efficient patient care with the accurate and ethical application of diagnostic tools. For an EKG technician, understanding the fundamental purpose of electrocardiography is paramount. This knowledge directly impacts their ability to perform tests correctly, interpret preliminary findings within their scope, and communicate effectively with supervising medical professionals. The challenge lies in ensuring that the technical execution of the EKG is not merely a procedural step, but a critical component of a diagnostic process aimed at identifying cardiac abnormalities. The correct approach emphasizes the diagnostic purpose of electrocardiography, aligning with the core principles of patient care and the regulatory framework governing certified EKG technicians. This approach recognizes that the EKG is not just a recording of electrical activity, but a tool for detecting and assessing a range of cardiac conditions, from arrhythmias to myocardial ischemia. Adhering to this understanding ensures that the technician performs their duties with precision, attention to detail, and an awareness of the potential clinical significance of the data they collect. This aligns with the ethical obligation to provide competent care and the regulatory requirement to perform services within the scope of practice, ultimately contributing to accurate diagnosis and appropriate patient management. An incorrect approach that focuses solely on the technical recording of electrical signals without understanding its diagnostic purpose is professionally unacceptable. This failure represents a significant ethical lapse, as it prioritizes mechanical execution over patient well-being and diagnostic accuracy. It can lead to misinterpretation of findings, delayed or incorrect diagnoses, and ultimately compromised patient care. From a regulatory standpoint, such an approach demonstrates a lack of understanding of the fundamental purpose of the procedure, which could be considered a failure to meet the standards of competence expected of a certified EKG technician. Another incorrect approach that prioritizes speed over accuracy, even if it appears cost-effective, is also professionally flawed. While efficiency is valued, it must never come at the expense of the quality of diagnostic information. The regulatory framework for EKG technicians mandates adherence to established protocols and a commitment to obtaining reliable data. Sacrificing accuracy for speed can lead to artifacts, improper lead placement, or incomplete recordings, all of which can render the EKG useless or misleading for diagnostic purposes. This directly contravenes the ethical duty to provide accurate and reliable services. The professional reasoning process for an EKG technician should begin with a clear understanding of the definition and purpose of electrocardiography as a diagnostic tool. This foundational knowledge should guide every step of the procedure, from patient preparation and lead placement to the actual recording and initial review of the tracing. When faced with a situation where efficiency or cost might seem to conflict with thoroughness, the technician must always prioritize the integrity of the diagnostic data and the well-being of the patient. This involves adhering strictly to established protocols, seeking clarification when unsure, and understanding the limitations of their role while recognizing the critical importance of the information they gather for the diagnosing physician. Question 5. Investigation of patient's EKG reveals unusual morphology in the augmented limb leads. The technician recalls placing the electrodes on the patient's arms and left leg, but is unsure if the right arm electrode was definitively placed on the correct limb, Which of the following actions best addresses this potential implementation challenge to ensure diagnostic accuracy and adherence to certification standards? Option A. Proceed with the current tracing, assuming the placement was correct as the technician remembers placing electrodes on the arms and left leg, and the morphology issues are likely due to patient condition. Option B. Place the remaining limb electrodes on the torso to improve signal clarity, as this is sometimes done for other EKG leads. Option C. Reperform the EKG tracing, meticulously verifying the placement of each augmented limb lead electrode on its designated limb, right arm for a VR, left arm for a VL, left leg for a VF, according to established EKG technician protocols. Option D. Adjust the EKG machine's gain settings to compensate for potential signal variations caused by the uncertain lead placement. Correct answer is C. Reperform the EKG tracing, meticulously verifying the placement of each augmented limb lead electrode on its designated limb, right arm for a VR, left arm for a VL, left leg for a VF, according to established EKG technician protocols. Explanation. Scenario analysis. This scenario presents a common implementation challenge in EKG acquisition, specifically concerning the augmented limb leads. The challenge lies in ensuring accurate lead placement to obtain diagnostically useful tracings, particularly when patient anatomy or positioning may deviate from the ideal. Misplacement of electrodes for a VR, a VL, and a VF can lead to artifactual findings or mask true abnormalities, directly impacting diagnostic interpretation and subsequent patient care decisions. The technician's responsibility is to adhere to established protocols to minimize these risks, requiring a keen understanding of lead placement principles and the potential consequences of errors. Correct approach analysis. The correct approach involves a systematic and precise application of EKG lead placement guidelines, specifically for the augmented limb leads. This means verifying the correct anatomical location for each electrode as per the certified EKG technician certification standards. For a VR, the electrode is placed on the right arm. For a VL, it's on the left arm. For a VF, it's on the left leg. Ensuring proper skin preparation, secure electrode adhesion, and avoiding areas of excessive muscle mass or bony prominences are critical. This meticulous adherence to placement protocols directly aligns with the regulatory framework and guidelines for EKG technicians, which prioritize accurate data acquisition for reliable diagnostic interpretation. This approach minimizes artifact and ensures the leads are sensing the electrical activity from the intended anatomical locations, thereby upholding the integrity of the EKG tracing and supporting sound clinical decision-making. Incorrect approach is analysis. One incorrect approach involves assuming standard placement without verification, especially if the patient has unusual limb positioning or significant edema. This failure to verify placement violates the principle of accurate data acquisition mandated by certification standards. It can lead to leads sensing electrical activity from unintended areas, creating misleading EKG waveforms and potentially resulting in misdiagnosis. Another incorrect approach is to rely solely on visual cues without confirming the specific limb associated with each augmented lead. For instance, confusing the right arm with the left arm electrode placement for a VL or a VR would fundamentally alter the electrical vector being recorded, rendering the tracing diagnostically inaccurate and non-compliant with best practices. A third incorrect approach might be to place electrodes on the torso instead of the limbs for the augmented limb leads, which is a gross deviation from established protocols and would produce completely uninterpretable or misleading data for these specific leads. These failures represent a direct contravention of the technical standards expected of a certified EKG technician, potentially leading to patient harm through incorrect medical management. Professional reasoning. Professionals should approach EKG lead placement with a mindset of meticulous accuracy and patient safety. This involves understanding the anatomical basis of each lead and consistently applying standardized placement techniques. When faced with potential challenges like unusual patient anatomy or positioning, the professional decision-making process should include 1. Reevaluating the patient's anatomy and the specific lead placement requirements. 2. Consulting EKG placement guides or protocols if unsure. 3. Communicating any concerns about placement accuracy to a supervisor or interpreting physician. 4. prioritizing accurate data acquisition over speed or convenience. This systematic approach ensures that the EKG tracing is a true representation of the patient's cardiac electrical activity, fulfilling the ethical and regulatory obligations of a certified EKG technician. Question 6. The assessment process reveals a patient's EKG tracing shows a consistently elevated heart rate and a visually perceived increase in the amplitude of the QRS complexes, suggesting increased myocardial contractility. Considering the autonomic nervous system's role in heart function, which of the following best describes the likely underlying physiological influence? Option A. Dominance of parasympathetic nervous system activity. Option B. Inhibition of both sympathetic and parasympathetic systems. Option C. Activation of the sympathetic nervous system. Option D. A balanced state with no significant autonomic influence. The correct answer is C. Activation of the sympathetic nervous system. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the EKG technician to interpret subtle physiological responses to a patient's condition and relate them to the underlying autonomic nervous system's influence on cardiac function. The challenge lies in distinguishing between normal physiological variations and signs that might indicate a significant autonomic imbalance or dysfunction, which could impact patient care and require further medical evaluation. Accurate interpretation is crucial for providing relevant information to the supervising physician. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying the physiological manifestations of sympathetic nervous system activation. Increased heart rate and a more forceful contraction are direct results of sympathetic stimulation via norepinephrine and epinephrine, which bind to beta-1 adrenergic receptors in the sinoatrial SA node and cardiac muscle, respectively. This leads to increased cardiac output, a compensatory mechanism often seen in response to stress, pain, or hypovolemia. This understanding aligns with the scope of practice for a certified EKG technician, who is expected to recognize and report significant findings related to cardiac electrical activity and its underlying physiological drivers. Regulatory guidelines for EKG technicians emphasize accurate data collection and reporting of findings that may influence patient diagnosis and treatment. Incorrect approaches analysis. An incorrect approach would be to attribute these findings solely to parasympathetic nervous system activity. The parasympathetic system, primarily mediated by the vagus nerve and acetylcholine, generally slows the heart rate and decreases contractility, which is the opposite of what is observed. Misinterpreting these signs as parasympathetic effects would lead to inaccurate reporting and potentially misguided clinical decisions, violating the ethical obligation to provide precise and reliable patient data. Another incorrect approach would be to ignore the observed changes, failing to recognize their potential significance. This constitutes a failure to adhere to professional standards of care, which mandate vigilance and reporting of any deviations from expected physiological norms that could impact patient well-being. Such an action could be considered a breach of professional responsibility, as it neglects a critical aspect of patient monitoring. Professional reasoning. Professionals should approach such situations by first observing and documenting all EKG findings and associated patient vital signs. They should then consider the known physiological mechanisms governing heart function, particularly the roles of the sympathetic and parasympathetic nervous systems. When presented with changes like increased heart rate and contractility, the professional should systematically evaluate potential causes, prioritizing those consistent with known autonomic influences. If the observed changes are significant or unexplained, the next step is to promptly and accurately report these findings to the supervising physician or appropriate healthcare provider, providing a clear and concise summary of the observations and their potential implications. This systematic approach ensures that patient care is based on accurate data and sound physiological understanding, adhering to both regulatory requirements and ethical obligations. Question 7. Market research demonstrates that certified EKG technicians are increasingly expected to integrate patient-reported symptoms with EKG findings for more comprehensive patient assessment. A patient presents with complaints of chest tightness and shortness of breath. The EKG tracing reveals a QRS complex duration that is noticeably wider than the typical range. Considering the patient's subjective experience and the objective EKG finding, Which of the following actions best reflects the technician's responsibility and best professional practice? Option A. Inform the patient that the widened QRS complex is likely insignificant and not related to their symptoms. Option B. Report the widened QRS complex and the patient's reported symptoms of chest tightness and shortness of breath to the supervising physician immediately. Option C. Focus solely on the widened QRS complex measurement and disregard the patient's reported symptoms as subjective data not relevant to EKG interpretation. Option D. Document the widened QRS complex in the patient's chart, but do not report it to the physician, assuming it is a known baseline finding for this patient. The correct answer is B. Report the widened QRS complex and the patient's reported symptoms of chest tightness and shortness of breath to the supervising physician immediately. Explanation. Scenario analysis. This scenario presents a challenge in interpreting EKG findings in a real-world clinical setting where patient presentation is key. The technician must move beyond simply identifying EKG components to understanding their clinical significance in the context of the patient's symptoms. This requires integrating EKG data with patient assessment, a critical skill for effective patient care and communication with the supervising physician. The challenge lies in discerning which EKG abnormality, when correlated with the patient's reported symptoms, warrants immediate attention and reporting. Correct approach analysis. The correct approach involves recognizing that a widened QRS complex, particularly when associated with symptoms like chest pain and shortness of breath, can indicate a serious underlying cardiac issue such as a bundle branch block or ventricular ectopy. Promptly reporting this finding, along with the patient's symptoms, to the supervising physician is crucial. This aligns with the certified EKG technician's role in accurately documenting and communicating critical EKG findings that may impact patient diagnosis and treatment, adhering to the principle of patient safety and timely intervention as expected within healthcare regulations. Incorrect approaches analysis. One incorrect approach is to focus solely on the presence of a widened QRS complex without considering the patient's subjective experience. While a widened QRS is an objective finding, its clinical relevance is amplified by accompanying symptoms. Ignoring symptoms and only reporting the EKG finding could lead to a delayed or misdiagnosis of a critical condition. This fails to meet the standard of comprehensive patient assessment and communication. Another incorrect approach is to dismiss the widened QRS complex as a normal variant without further investigation or reporting, especially when the patient is symptomatic. This overlooks potential underlying pathology that the EKG might be revealing. It represents a failure to exercise due diligence in interpreting potentially significant EKG abnormalities and communicating them to the appropriate medical personnel, potentially violating guidelines for reporting critical findings. A third incorrect approach is to overinterpret the EKG finding and assume a specific diagnosis without physician confirmation. While the technician's role is to identify abnormalities and report them, making a definitive diagnosis is outside their scope of practice and regulatory purview. This could lead to miscommunication and inappropriate patient management. Professional reasoning. Professionals should approach EKG interpretation by first identifying all objective EKG findings, including the morphology and duration of the QRS complex. Simultaneously, they must gather and document subjective patient information, such as reported symptoms. The critical step is to correlate these two sets of data. If a significant EKG abnormality, like a widened QRS, is present, and the patient is experiencing concerning symptoms, the professional decision-making process dictates immediate communication with the supervising physician. This ensures that the physician has all relevant information to make an informed diagnostic and treatment plan, prioritizing patient safety and adherence to established clinical protocols. Question 8. Operational review demonstrates that an EKG technician has identified a subtle but potentially significant deviation in a patient's EKG tracing that suggests an underlying electrical conduction abnormality. The technician has brought this to the attention of the attending physician, who has reviewed the tracing and stated that it is within normal limits for the patient. The technician, however, remains concerned based on their training and the specific characteristics of the deviation. What is the most appropriate and ethically sound course of action for the EKG technician in this situation? Option A. Directly inform the patient that their EKG may have been misinterpreted and that a serious condition might be present. Option B. Document the physician's assessment in the patient's chart and proceed with other duties, trusting the physician's expertise. Option C. Discreetly inform a trusted colleague about the discrepancy and ask for their opinion on the tracing. Option D. Escalate the concern to a supervisor or the physician again, providing specific details about the observed deviation and the rationale for concern, requesting a further review. Correct answer is B. Document the physician's assessment in the patient's chart and proceed with other duties, trusting the physician's expertise. Explanation. Scenario analysis. This scenario presents an ethical dilemma for an EKG technician. The technician has observed a potential anomaly in a patient's EKG tracing that could indicate a serious cardiac issue, but the physician has already reviewed the tracing and deemed it within normal limits. The challenge lies in balancing the technician's professional responsibility to patient care with the physician's authority and established diagnostic process. Overstepping boundaries could undermine the physician's role, while ignoring a potentially critical finding could jeopardize patient safety. Careful judgment is required to navigate this situation ethically and professionally, adhering to established protocols and the scope of practice. Correct approach analysis. The correct approach involves escalating the concern through the appropriate channels without directly contradicting the physician's initial assessment. This upholds best professional practice by prioritizing patient safety while respecting the established hierarchy of care. The Certified EKG Technician Certification Guidelines emphasize the importance of accurate data collection and reporting, as well as the technician's role in identifying and reporting potential abnormalities. By bringing the concern to the attention of a supervisor or the physician again, with specific details about the observed anomaly and its potential implications, the technician fulfills their duty of care. This action ensures that a potentially overlooked finding is re-evaluated, aligning with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. It also adheres to the regulatory framework that expects healthcare professionals to act diligently and report any suspected deviations from normal findings that could impact patient health. Incorrect approaches analysis. One incorrect approach is to accept the physician's assessment without further action, even with a strong suspicion of an anomaly. This fails to meet the professional standard of vigilance and advocacy for the patient. It represents a regulatory failure by not adhering to the expectation that technicians report significant findings, and an ethical failure by potentially allowing harm to occur due to inaction, violating non-maleficence. Another incorrect approach is to directly confront the physician and insist that their interpretation is wrong. This is professionally unacceptable, as it undermines the physician's authority and scope of practice, potentially creating a hostile work environment. It is a regulatory failure by overstepping the technician's defined role and an ethical failure by demonstrating a lack of professional courtesy and collaboration, which can hinder effective patient care. A third incorrect approach is to discuss the patient's EKG findings with colleagues or other non-authorized personnel. This is a significant breach of patient confidentiality, a fundamental ethical and regulatory requirement. It also demonstrates a lack of professional judgment and an inappropriate way to address a clinical concern. Professional reasoning. Professionals should approach such situations by first reviewing their observations and the patient's chart for any supporting evidence or context. They should then consult their immediate supervisor or a designated senior technician to discuss their concerns and seek guidance on the appropriate next steps. If the supervisor agrees with the concern, they can then facilitate a re-evaluation by the physician or another qualified clinician. This process ensures that concerns are addressed systematically, respecting professional roles and responsibilities while prioritizing patient well-being. The decision-making process should always be guided by patient safety, adherence to scope of practice, and established institutional protocols. Question 9. The analysis reveals an EKG tracing where a distinct deflection, following the T wave and preceding the next P wave, is observed in several leads. This deflection is not consistently present in all leads, and its amplitude is notable. What is the most appropriate identification and initial consideration for this waveform by a certified EKG technician? Option A. Identify this waveform as a P-wave variant and assume it is part of the atrial depolarization, requiring no further specific notation. Option B. Identify this waveform as an artifact and disregard it, as it does not represent a primary cardiac electrical event. Option C. Identify this waveform as a prolonged T wave and focus on its duration without considering its distinct morphology or timing. Option D. Identify this waveform as a U wave and consider its potential association with conditions such as hypokalemia or certain medications, prompting accurate documentation for physician review. The correct answer is D. Identify this waveform as a U wave and consider its potential association with conditions such as hypokalemia or certain medications, prompting accurate documentation for physician review. Explanation. The analysis reveals a scenario where a certified EKG technician is presented with an EKG tracing that exhibits a prominent U wave. This situation is professionally challenging because the presence and morphology of U waves can be subtle, easily overlooked, or misinterpreted, potentially leading to misdiagnosis or delayed treatment. The technician must possess a keen eye for detail and a thorough understanding of EKG waveform interpretation, specifically concerning the U wave, to accurately document and report findings. Careful judgment is required to differentiate a normal U wave from one that signifies underlying pathology. The correct approach represents best professional practice because it prioritizes accurate identification and contextualization of the U wave. By recognizing the U wave and understanding its potential significance, the technician ensures that this finding is appropriately documented and communicated to the supervising physician or healthcare provider. This adherence to proper EKG interpretation protocols, as outlined by professional certification standards and accepted clinical guidelines, is crucial for patient care. The technician's role is to provide a clear and accurate tracing with relevant observations, enabling the physician to make informed diagnostic and therapeutic decisions. This aligns with the ethical obligation to provide competent and diligent care. An incorrect approach that focuses solely on the absence of other obvious abnormalities, like ST segment changes or significant arrhythmias, would be professionally unacceptable. This failure to identify and report a potentially significant U wave represents a lapse in diagnostic diligence and could lead to missed opportunities for early intervention. It violates the principle of thoroughness in EKG interpretation. Another incorrect approach that dismisses the U wave as insignificant without considering the patient's clinical context or potential etiologies, such as electrolyte imbalances or certain medications, is also professionally unsound. This demonstrates a lack of understanding of the clinical implications of U wave abnormalities and a failure to adhere to comprehensive EKG interpretation standards. Finally, an approach that attempts to diagnose the underlying cause of the U wave without physician consultation oversteps the technician's scope of practice and is a regulatory and ethical failure. The technician's responsibility is to accurately record and report, not to diagnose. Professional reasoning in such situations involves a systematic approach. First, meticulously examine all components of the EKG tracing, including P waves, QRS complexes, T waves, and U waves. Second, compare the observed U wave characteristics, amplitude, polarity, presence in specific leads, against established normal parameters and known pathological presentations. Third, consider the patient's clinical history and any concurrent medications or conditions that might influence EKG findings. Fourth, accurately document the presence, morphology, and lead distribution of the U wave. Finally, report these findings clearly and concisely to the supervising physician, allowing them to integrate this information into their overall assessment. Question 10. Market research demonstrates that healthcare professionals often require a nuanced understanding of the body's major blood vessels to effectively interpret diagnostic data. For a certified EKG technician, which of the following best describes the critical functional role of major blood vessels in relation to EKG interpretation? Option A. The main role of major blood vessels is to regulate blood pressure throughout the body, which is a separate physiological parameter from cardiac electrical conduction. Option B. Major blood vessels serve as conduits for the electrical impulses generated by the heart's conduction system to reach the peripheral tissues. Option C. The primary function of major blood vessels, particularly the coronary arteries, is to supply oxygenated blood to the myocardium, and any compromise in this supply directly impacts myocardial electrical activity, which is reflected in the EKG. Option D. Major blood vessels are primarily responsible for transporting deoxygenated blood back to the lungs for oxygenation, a process indirectly influencing cardiac output. The correct answer is C. The primary function of major blood vessels, particularly the coronary arteries, is to supply oxygenated blood to the myocardium, and any compromise in this supply directly impacts myocardial electrical activity, which is reflected in the EKG. Explanation: this scenario presents a professional challenge because a certified EKG technician must accurately identify and understand the function of major blood vessels to correctly interpret EKG readings and communicate findings. Misidentification or misunderstanding of a vessel's role can lead to incorrect diagnosis, delayed or inappropriate treatment, and potential patient harm. The technician's role requires a foundational knowledge of cardiovascular anatomy and physiology, which directly impacts their ability to perform their duties effectively and safely within the scope of practice. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the circulatory system's key components and their specific roles in oxygen and nutrient delivery, as well as waste removal. This knowledge is essential for interpreting the electrical activity of the heart in the context of blood flow and oxygenation. Adherence to the regulatory framework for certified EKG technicians, which implicitly requires anatomical and physiological competence, ensures that the technician is providing accurate and reliable diagnostic information. This aligns with the ethical obligation to provide competent patient care and uphold the standards of the profession. An incorrect approach that focuses solely on the electrical conduction system without considering the vascular supply to the myocardium fails to acknowledge the interconnectedness of these systems. The heart muscle itself requires oxygenated blood to function, and blockages or abnormalities in the coronary arteries, major blood vessels supplying the heart, directly impact EKG findings. Failing to understand this relationship is a significant deficiency in diagnostic interpretation and violates the implicit requirement for comprehensive knowledge expected of a certified technician. Another incorrect approach that prioritizes external anatomical landmarks over the internal function of major blood vessels is also professionally unacceptable. While external landmarks are important for lead placement, the technician's primary responsibility is to interpret the EKG's representation of cardiac electrical activity and its relationship to myocardial perfusion. Focusing only on external anatomy neglects the critical internal vascular dynamics that influence the EKG. This demonstrates a lack of understanding of the diagnostic purpose of the EKG. A third incorrect approach that conflates the function of arteries and veins in the systemic circulation with the specific role of coronary arteries in myocardial perfusion is a critical error. While both are blood vessels, the coronary arteries are uniquely responsible for supplying the heart muscle itself, and their function is directly assessed through EKG interpretation. General knowledge of systemic circulation is insufficient for the specific demands of EKG analysis. Professional reasoning process for a certified EKG technician in this context should involve a systematic approach. First, understanding the EKG tracing as a representation of electrical activity. Second, correlating this activity with the anatomical structures of the heart and the major blood vessels that supply it. And third, considering how the function of these blood vessels, particularly the coronary arteries, might be influencing the observed electrical patterns. This integrated approach ensures accurate interpretation and effective communication of findings to the interpreting physician. Question 11. Research into the interpretation of EKG waveform morphology reveals that technician is presented with a tracing exhibiting a narrow QRS complex, a regular rhythm at 75 beats per minute, and the absence of discernible P waves preceding each QRS complex, with retrograde P waves occasionally appearing after the QRS. Which of the following approaches best reflects a comprehensive and accurate interpretation of this waveform morphology according to best practices for a certified EKG technician? Option A. Report the finding of absent P waves as an artifact and proceed to interpret the rhythm based on the rate alone. Option B. Immediately conclude that the absence of P waves indicates a critical cardiac emergency requiring immediate physician intervention without further waveform analysis. Option C. Systematically evaluate the P wave, QRS complex, and T wave morphology in conjunction with the rhythm and rate, noting the absence of P waves before the QRS and the presence of retrograde P waves after, suggesting a junctional rhythm. Option D. Focus solely on the narrow QRS complex, assuming it represents a normal sinus rhythm despite the absence of P waves. The correct answer is C. Systematically evaluate the P wave, QRS complex, and T wave morphology in conjunction with the rhythm and rate, noting the absence of P waves before the QRS and the presence of retrograde P waves after, suggesting a junctional rhythm. Explanation. Scenario analysis. Interpreting EKG waveform morphology is a cornerstone of EKG technician certification. This scenario presents a challenge because subtle variations in waveform characteristics can indicate significant underlying cardiac pathology. The technician must not only identify the morphology, but also understand its clinical implications, requiring a blend of technical knowledge and critical thinking. The pressure to provide accurate and timely information to the interpreting physician necessitates a systematic and evidence-based approach. Correct approach analysis. The correct approach involves a systematic evaluation of all EKG components, including the P wave, QRS complex, and T wave, in relation to each other and the cardiac rhythm. This aligns with best practices in EKG interpretation, emphasizing a comprehensive review rather than focusing on isolated findings. Regulatory frameworks for EKG technicians, such as those outlined by certifying bodies in the U.S., e.g., NHA AMCA, mandate a thorough understanding of normal and abnormal EKG findings. This systematic approach ensures that no critical diagnostic clues are missed, directly supporting patient safety and accurate diagnosis, which is an ethical imperative for healthcare professionals. Incorrect approaches analysis, focusing solely on the presence of a specific abnormality, such as ST segment elevation, without considering the overall rhythm and other waveform characteristics, is a significant regulatory and ethical failure. This narrow focus can lead to misinterpretation, as ST segment elevation can have various causes, and its significance is context-dependent. It violates the principle of comprehensive patient assessment, ignoring subtle but potentially significant waveform changes, like a slight widening of the QRS complex or an inverted T wave in a specific lead, is another failure. Best practices and certification guidelines stress the importance of recognizing these nuances, as they can be early indicators of ischemia or other critical conditions. Failing to report such findings can delay diagnosis and treatment, breaching the duty of care owed to the patient. Relying on automated EKG interpretation software without independent verification of waveform morphology is also professionally unacceptable. While software can be a helpful tool, it is not a substitute for the technician's trained judgment. Regulatory standards for EKG technicians emphasize the need for human oversight and interpretation, as software can sometimes misinterpret complex rhythms or artifacts. This reliance can lead to diagnostic errors and is a failure to uphold professional standards. Professional reasoning. Professionals should approach EKG interpretation with a structured methodology. This involves 1. Assessing the rhythm, rate, and regularity. 2. Evaluating the P wave's presence, morphology, relationship to QRS. 3. Measuring and analyzing the PR interval. 4. Measuring and analyzing the QRS complex duration and morphology. 5. Evaluating the ST segments and T waves for deviations from baseline and morphology. And 6. Assessing the QT interval. This systematic process, grounded in established EKG interpretation protocols and regulatory guidelines for certified technicians, ensures a thorough and accurate assessment, prioritizing patient well-being and diagnostic integrity. Question 12. Examination of the data shows a patient's EKG tracing exhibiting irregular RR intervals, absent P waves, and a chaotic baseline, with an average ventricular rate of 145 beats per minute. The technician has reviewed the tracing and confirmed the findings are not artifact. What is the most appropriate immediate action for the certified EKG technician? Option A. Inform the patient that they have an irregular heartbeat and advise them to rest. Option B. Document the EKG findings in the patient's chart and proceed with the next scheduled patient. Option C. Attempt to adjust the EKG leads or reposition the patient to see if the rhythm changes. Option D. Notify the supervising physician or qualified healthcare provider of the findings, specifically noting atrial fibrillation with a rapid ventricular response. The correct answer is D. Notify the supervising physician or qualified healthcare provider of the findings, specifically noting atrial fibrillation with a rapid ventricular response. Explanation. This scenario presents a common implementation challenge for a certified EKG technician, accurately interpreting and responding to potentially life-threatening arrhythmias in a patient. The challenge lies in distinguishing between different atrial arrhythmias, understanding their implications, and knowing the appropriate immediate actions within the scope of practice, all while adhering to established protocols and patient safety guidelines. The technician must rely on their knowledge of EKG interpretation and their understanding of the healthcare facility's policies and procedures. The correct approach represents best professional practice because it prioritizes patient safety and timely, appropriate intervention based on a correct EKG interpretation. By identifying atrial fibrillation with a rapid ventricular response, the technician recognizes a condition that requires immediate medical attention to prevent complications such as hemodynamic instability or thromboembolic events. Reporting this finding promptly to the supervising physician or qualified healthcare provider ensures that the patient receives the necessary medical management, which aligns with the technician's role in assisting with patient care and monitoring. This adheres to the ethical principle of beneficence and the regulatory expectation of competent performance within the scope of practice. An incorrect approach of simply documenting the finding without immediate notification fails to address the urgency of a rapid ventricular response in atrial fibrillation. This oversight could lead to significant patient harm due to delayed treatment, violating the ethical duty to act in the patient's best interest and potentially contravening facility policies regarding critical EKG findings. Another incorrect approach of attempting to fix the rhythm or administer medication is outside the scope of practice for a certified EKG technician and constitutes a serious ethical and regulatory violation, potentially leading to patient injury and legal repercussions. Lastly, dismissing the finding as a common artifact without further investigation ignores the possibility of a genuine, critical arrhythmia and demonstrates a lack of diligence and adherence to proper diagnostic procedures. Professional decision-making in such situations requires a systematic approach. First, accurately interpret the EKG tracing, identifying any abnormalities. Second, assess the clinical significance of the abnormality based on established knowledge and protocols. Third, determine the appropriate immediate action within the scope of practice, which typically involves notifying a supervising physician or qualified healthcare provider of critical findings. Finally, document the findings and actions taken accurately and thoroughly. This process ensures patient safety, compliance with regulations, and ethical practice. Question 13. The assessment process reveals that a certified EKG technician is explaining the path of blood flow through the heart to a patient. Which of the following explanations most accurately and clearly describes this process for a layperson? Option A. Blood flows from the body into the right atrium, then the right ventricle, then the pulmonary artery to the lungs, then the pulmonary veins to the left atrium, then the left ventricle, and finally the aorta to the body. Option B. The right side of the heart handles deoxygenated blood, and the left side handles oxygenated blood, with blood moving between these sides through the septum. Option C. Deoxygenated blood enters the right atrium, then flows into the right ventricle. The right ventricle pumps this blood to the lungs to pick up oxygen. Oxygenated blood then returns from the lungs to the left atrium, moves into the left ventricle, and the left ventricle pumps this oxygen-rich blood to the rest of the body. Option D. Blood enters the heart through the vena cava, goes to the ventricles, then to the atria, and is then pumped out. The correct answer is C. Deoxygenated blood enters the right atrium, then flows into the right ventricle. The right ventricle pumps this blood to the lungs to pick up oxygen. Oxygenated blood then returns from the lungs to the left atrium, moves into the left ventricle, and the left ventricle pumps this oxygen-rich blood to the rest of the body. Explanation. The assessment process reveals a scenario where a certified EKG technician is tasked with explaining the path of blood flow through the heart to a patient. This scenario is professionally challenging because it requires not only accurate anatomical and physiological knowledge, but also the ability to communicate complex medical information in a clear, understandable, and empathetic manner to a layperson. The technician must ensure the patient comprehends the information to alleviate anxiety and promote adherence to treatment plans, all while operating within the scope of practice defined by regulatory bodies. The correct approach represents best professional practice because it prioritizes patient education and understanding, which is a cornerstone of ethical healthcare delivery. By accurately tracing the path of blood flow from the body to the lungs and back, and then to the rest of the body, the technician demonstrates competence and adherence to the principles of clear communication. This aligns with the general ethical guidelines for healthcare professionals to provide accurate information and empower patients. While specific regulations for EKG technicians regarding patient education might vary, the overarching principle of providing accurate and understandable information is universally expected and is implicitly supported by the need for competent practice. An incorrect approach that focuses solely on listing chambers and valves without explaining the functional sequence of blood flow fails to meet the patient's need for comprehension. This could be seen as a failure in effective communication, potentially leading to patient confusion and anxiety, which indirectly impacts patient care. Another incorrect approach that uses overly technical jargon without simplification would similarly fail to educate the patient, violating the principle of clear communication. A third incorrect approach that omits key steps in the circulatory pathway, such as the pulmonary circulation, will be factually inaccurate and misleading, representing a significant failure in providing correct information and potentially leading to patient misunderstanding of their condition. Professional reasoning in such situations involves a systematic approach. First, accurately recalling the physiological process of blood flow. Second, translating that knowledge into simple, accessible language. Third, assessing the patient's understanding through observation and questioning. And fourth, ensuring the explanation remains within the technician's scope of practice, avoiding medical diagnosis or treatment advice. Question 14. To address the challenge of a certified EKG technician encountering a patient with a rapid, wide complex tachycardia on the EKG, which of the following represents the most appropriate and professionally responsible course of action, adhering strictly to the regulatory framework for certified EKG technicians? Option A. Ignore the wide complex tachycardia, assuming it is a temporary artifact, and proceed with routine EKG acquisition for other patients. Option B. Attempt to determine the specific underlying cause of the tachycardia and suggest potential treatment options to the patient. Option C. Immediately document the findings and report the presence of a wide complex tachycardia to the supervising physician or appropriate healthcare provider for further assessment and management. Option D. Document the EKG findings but wait until the end of the shift to report the wide complex tachycardia to the supervising physician. The correct answer is C. Immediately document the findings and report the presence of a wide complex tachycardia to the supervising physician or appropriate healthcare provider for further assessment and management. Explanation. Scenario analysis. The scenario presents a critical challenge for a certified EKG technician, CET, involving a patient exhibiting signs of a potentially life-threatening ventricular arrhythmia. The primary challenge lies in the immediate need for accurate EKG interpretation and timely communication of findings to the appropriate healthcare provider, balancing patient safety with adherence to established protocols. Misinterpretation or delayed reporting can have severe consequences for patient outcomes. The CET must possess a strong understanding of various arrhythmias, including junctional and ventricular types, and their clinical implications. Correct approach analysis. The correct approach involves the CET meticulously analyzing the EKG tracing to identify the specific characteristics of the observed rhythm. This includes assessing the rate, rhythm, P waves, PR interval, QRS duration, and ST segments. Upon recognizing a junctional rhythm or ventricular tachycardia, the CET must immediately and accurately document their findings and report them to the supervising physician or qualified healthcare professional responsible for patient care. This adheres to the principle of patient safety and the scope of practice for a CET, which mandates accurate data collection and prompt reporting of critical findings. Regulatory frameworks for EKG technicians emphasize the importance of recognizing and reporting abnormal rhythms to ensure timely medical intervention. Incorrect approaches analysis. One incorrect approach would be to dismiss the abnormal rhythm as a transient artifact or a less critical finding without thorough analysis and reporting. This failure to recognize and report a potentially serious arrhythmia constitutes a significant breach of professional responsibility and regulatory guidelines, potentially leading to delayed or absent treatment. Another incorrect approach would be to attempt to diagnose the underlying cause or prescribe treatment which falls outside the CET's scope of practice and regulatory authority. This overstepping of professional boundaries can lead to medical errors and patient harm. Finally, delaying the reporting of a critical finding due to workload or uncertainty without seeking immediate clarification is also a failure. Regulatory bodies expect prompt communication of critical EKG findings to ensure patient safety and facilitate appropriate medical management. Professional reasoning. Professionals should approach such situations by first ensuring they have a clear understanding of the patient's baseline EKG if available. They must then systematically interpret the current EKG, applying their knowledge of normal and abnormal rhythms. If an abnormality is detected, especially one that could be life-threatening like ventricular tachycardia, the immediate priority is accurate documentation and urgent notification of the supervising physician. If there is any doubt about the interpretation, the CET should err on the side of caution and seek immediate consultation from a qualified supervisor or physician. This decision-making process prioritizes patient safety, adheres to the established scope of practice, and complies with regulatory requirements for reporting critical findings. Question 15. Analysis of an electrocardiogram reveals a widened QRS complex. Which of the following approaches best reflects the basic principles of electrocardiography for an EKG technician? Option A. Immediately conclude that the patient has a bundle branch block based solely on the widened QRS complex. Option B. Assess the duration of the QRS complex and evaluate its morphology in conjunction with the overall rhythm and the presence of P waves to determine the origin of the ventricular depolarization. Option C. Focus on the heart rate and ignore the widened QRS complex, assuming it is a minor variation. Option D. Interpret the widened QRS complex as a sign of atrial fibrillation without further analysis of other EKG components. The correct answer is B. Assess the duration of the QRS complex and evaluate its morphology in conjunction with the overall rhythm and the presence of P waves to determine the origin of the ventricular depolarization. Explanation. This scenario presents a professional challenge because an EKG technician must interpret subtle variations in waveform morphology to accurately identify potential cardiac abnormalities, while strictly adhering to established diagnostic criteria and patient safety protocols. Misinterpreting these waveforms can lead to incorrect diagnoses, delayed or inappropriate treatment, and potential patient harm, all of which carry significant regulatory and ethical implications. The correct approach represents best professional practice because it involves a systematic and evidence-based evaluation of the EKG tracing, comparing observed findings against established benchmarks for normal and abnormal electrocardiographic patterns. This aligns with the fundamental principles of electrocardiography and the regulatory requirement for certified technicians to perform their duties with competence and accuracy. Adherence to these principles ensures that patient care is based on reliable data and established medical knowledge, minimizing the risk of diagnostic error. An incorrect approach that focuses solely on a single, isolated waveform characteristic without considering the broader context of the EKG tracing is professionally unacceptable. This failure to conduct a comprehensive analysis violates the principle of thoroughness expected of a certified technician and could lead to a misdiagnosis. Ethically, it breaches the duty of care owed to the patient. Another incorrect approach that relies on anecdotal experience or personal opinion rather than established diagnostic criteria is also professionally unacceptable. It deviates from the scientific basis of electrocardiography and introduces subjectivity where objectivity is paramount. It fails to meet the regulatory standard for evidence-based practice and can lead to inconsistent and unreliable interpretations. A further incorrect approach that prioritizes speed over accuracy, leading to a superficial review of the EKG, is professionally unacceptable. This demonstrates a lack of diligence and a disregard for the potential consequences of a rushed interpretation. It violates the ethical obligation to provide careful and considered professional services and can result in significant patient safety risks. The professional reasoning process for similar situations should involve a structured approach. First, ensure proper lead placement and artifact identification. Second, systematically analyze each component of the EKG tracing P-wave, PR interval, QRS complex, ST segment, T-wave, QT interval in relation to each other and to the overall rhythm. Third, compare findings against established normal ranges and diagnostic criteria. Fourth, consider the patient's clinical presentation and history if available. And finally, document findings accurately and report any significant deviations from normal to the appropriate healthcare provider. This systematic, evidence-based, and patient-centered approach ensures the highest standard of care and regulatory compliance. Question 16. The efficiency study reveals that a new EKG technician is consistently interpreting T-wave inversions in a specific patient demographic as normal physiological variations, despite these patients not having a prior history of cardiac conditions that would explain such findings. The technician believes their interpretation is correct based on a limited understanding of T-wave morphology variation. What is the most appropriate immediate action for the technician to take? Option A. Continue interpreting the T-wave inversions as benign variations, assuming their understanding is sufficient until a patient experiences a significant cardiac event. Option B. Discuss the findings and interpretations with other EKG technicians to confirm their assessment before escalating to a physician. Option C. Immediately report the observed pattern of T-wave inversions and their interpretation to the supervising physician or cardiologist for further review and guidance. Option D. Document the T-wave inversions as normal variations and proceed with other patient care duties without further consultation. Correct answer is C. Immediately report the observed pattern of T-wave inversions and their interpretation to the supervising physician or cardiologist for further review and guidance. Explanation. The efficiency study reveals that a new EKG technician, Sarah, is consistently interpreting T-wave inversions as benign variations in a specific patient population, leading to delayed further cardiac evaluation. This scenario is professionally challenging because it involves a direct impact on patient care and potential harm due to a misinterpretation of a critical EKG waveform. The Certified EKG Technician Certification exam emphasizes the importance of accurate interpretation and understanding the clinical significance of EKG findings. Sarah's actions, while potentially stemming from a lack of experience or understanding, create an ethical dilemma regarding patient safety and the technician's responsibility to report findings accurately. The correct approach is to immediately report the observed pattern of T-wave inversions and the technician's interpretation to the supervising physician or cardiologist. This represents best professional practice because it prioritizes patient safety and adheres to the fundamental principle of accurate EKG interpretation. Regulatory frameworks for EKG technicians, such as those outlined by the National Health Career Association, NHA, for the Certified EKG Technician Certification, mandate that technicians accurately record and report EKG findings. T-wave inversions can be indicative of serious underlying cardiac conditions, including ischemia or infarction, and failing to escalate these findings for further medical assessment constitutes a breach of professional duty and potentially violates patient care standards. Prompt reporting ensures that the physician can initiate appropriate diagnostic and therapeutic interventions, thereby preventing potential adverse outcomes. An incorrect approach would be to dismiss the T-wave inversions as normal variations without further investigation or consultation. This is professionally unacceptable because it demonstrates a failure to recognize the potential clinical significance of the finding and a disregard for the established protocols for EKG interpretation. This could lead to a delay in diagnosis and treatment, directly compromising patient well-being and violating the ethical obligation to provide competent care. Another incorrect approach would be to discuss the findings with colleagues without involving the supervising physician. While peer consultation can be valuable, it does not absolve the technician of their responsibility to report critical findings to the appropriate medical authority. This approach bypasses the established chain of command and delays definitive medical management, potentially putting patients at risk. A third incorrect approach would be to continue the current practice, assuming the interpretation is correct, and only address the issue if a patient experiences a negative outcome. This is a reactive and negligent approach that fails to uphold the proactive standard of care expected of certified EKG technicians. It demonstrates a lack of commitment to continuous learning and patient advocacy, and it directly contradicts the ethical imperative to act in the best interest of the patient. The professional reasoning process in such a situation should involve recognizing a deviation from expected findings, understanding the potential implications of that deviation, and acting decisively to ensure appropriate medical oversight. Certified EKG technicians are trained to identify abnormalities and understand their potential significance. When in doubt, or when a pattern suggests a potential problem, the technician must err on the side of caution and escalate the issue to a qualified physician for further evaluation and diagnosis. This ensures that patient care is guided by expert medical judgment and that potential cardiac events are addressed promptly and effectively. Question 17. Benchmark analysis indicates that a certified EKG technician is monitoring a patient's EKG when a sudden change occurs, revealing a rapid rhythm with wide QRS complexes and no discernible P waves. The patient is reportedly feeling dizzy and short of breath. What is the most appropriate immediate action for the technician? Option A. Advise the patient to take slow, deep breaths to help regulate their heart rhythm. Option B. Attempt to adjust the EKG leads to see if the tracing normalizes, assuming it is a lead placement issue. Option C. Document the EKG findings as artifact and continue with routine patient monitoring. Option D. Immediately notify the supervising physician or qualified healthcare provider of the critical EKG findings and the patient's symptoms. The correct answer is D. Immediately notify the supervising physician or qualified healthcare provider of the critical EKG findings and the patient's symptoms. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in EKG interpretation, identifying and responding to a potentially life-threatening arrhythmia. The professional challenge lies in the rapid assessment of the EKG tracing, correlating it with the patient's clinical presentation, and initiating appropriate management based on established protocols and the scope of practice for a certified EKG technician. Misinterpretation or delayed action can have severe consequences for patient outcomes. Correct approach analysis. The correct approach involves recognizing the characteristic features of ventricular tachycardia, VT, on the EKG-wide QRS complexes, rapid rate, and potential absence of P waves, and immediately alerting the supervising physician or qualified healthcare provider. This aligns with the certified EKG technician's role, which includes accurate EKG acquisition and preliminary interpretation within their defined scope. Prompt notification ensures timely medical intervention, such as defibrillation or antiarrhythmic medication, which is crucial for stabilizing the patient and preventing cardiac arrest. This adheres to ethical principles of patient advocacy and professional responsibility, as well as regulatory guidelines that mandate reporting critical findings. Incorrect approach is analysis. Failing to recognize the wide QRS complexes as indicative of a ventricular origin, and instead attributing them to artifact or a less critical supraventricular rhythm, demonstrates a failure in diagnostic interpretation, which is a core competency for an EKG technician. This delay in accurate identification can lead to inappropriate management or a lack of urgent intervention, violating the duty of care. Assuming the patient is stable without further assessment and proceeding with routine tasks, such as preparing for the next patient, ignores the potential severity of the observed arrhythmia. This constitutes negligence and a breach of professional responsibility, as critical findings must always be addressed with urgency. Attempting to manage the arrhythmia independently by administering medication or adjusting patient positioning without physician orders is a significant overstep of the certified EKG technician's scope of practice. This action is not only outside regulatory guidelines, but also poses a direct risk to the patient by interfering with established medical protocols and potentially causing harm. Professional reasoning. Professionals should employ a systematic approach. 1. Observe the EKG tracing carefully, noting rate, rhythm, QRS width, and presence/absence of P waves. 2. Correlate EKG findings with the patient's vital signs and subjective complaints. 3. Identify potential arrhythmias based on established criteria. 4. Immediately report critical findings to the appropriate supervisor or physician. 5. Document all findings and actions accurately. This structured decision-making process ensures patient safety and adherence to professional standards. Question 18. What factors determine the specific EKG waveform changes observed when there is compromised blood flow to the myocardium due to coronary artery disease? Option A. The location and extent of the coronary artery blockage and the specific myocardial territory supplied by the affected artery. Option B. The type of EKG machine used for the recording, irrespective of physiological changes. Option C. The patient's current medication regimen, regardless of the coronary artery's condition. Option D, the technician's personal preference for lead placement technique. Correct answer is A, the location and extent of the coronary artery blockage and the specific myocardial territory supplied by the affected artery. Explanation: this scenario is professionally challenging because an EKG technician must interpret the physiological implications of coronary circulation on EKG findings, understanding that deviations can indicate critical cardiac events. The technician's role is to accurately record and present EKG data, but a foundational understanding of coronary circulation allows for more informed observation and reporting, potentially leading to earlier recognition of concerning patterns. Careful judgment is required to distinguish normal variations from potentially pathological findings related to compromised coronary blood flow. The correct approach represents best professional practice because it directly links the technician's understanding of coronary circulation to the interpretation of EKG waveforms, recognizing how reduced blood flow to specific myocardial regions affects electrical activity, e.g., ST segment changes, T-wave inversions, is crucial for accurate data acquisition and preliminary observation. This aligns with the ethical responsibility to provide accurate and relevant patient information to the interpreting physician, contributing to timely diagnosis and treatment. Adherence to established EKG protocols and the scope of practice for a certified EKG technician, which includes understanding the physiological basis of EKG findings, is paramount. An incorrect approach that focuses solely on the mechanical aspects of EKG lead placement without considering the underlying physiological consequences of coronary circulation fails to leverage the technician's knowledge base. This is a regulatory failure, as it limits the technician's ability to provide comprehensive and potentially life-saving information. Another incorrect approach that prioritizes speed over accuracy in lead placement, without regard for the impact on waveform interpretation related to coronary perfusion, is an ethical failure. It compromises patient care by potentially obscuring critical diagnostic information. A third incorrect approach that involves independent diagnosis or treatment recommendations based on EKG findings exceeds the technician's scope of practice and is a significant regulatory and ethical violation, as diagnosis and treatment are the responsibility of a licensed physician. Professionals should employ a decision-making framework that begins with a thorough understanding of the physiological principles governing EKG interpretation, including coronary circulation. This understanding should guide the meticulous application of EKG lead placement techniques and the careful observation of EKG waveforms. When concerning patterns emerge, the professional reasoning process involves accurately documenting these findings and promptly communicating them to the supervising physician, adhering strictly to the established scope of practice and reporting protocols. Question 19. System analysis indicates that an EKG technician is reviewing a tracing and observes a subtle upward or downward shift of the ST segment. To ensure the most accurate preliminary assessment for physician review, which of the following represents the most effective and professionally sound approach to evaluating this observation? Option A. Ignore any ST segment deviation if the patient denies experiencing any chest pain, as this is likely an artifact. Option B. Focus solely on the ST segment's deviation in the lead that appears most abnormal, assuming it represents the primary pathology. Option C. Visually estimate the ST segment's position relative to what appears to be the baseline without a defined reference point, and note any perceived deviation. Option D. Compare the ST segment to the PR segment or TP segment to establish the isoelectric line. Then assess for consistent elevation or depression in contiguous leads, considering the patient's reported symptoms. The correct answer is D. Compare the ST segment to the PR segment or TP segment to establish the isoelectric line, then assess for consistent elevation or depression in contiguous leads, considering the patient's reported symptoms. Explanation: scenario analysis. This scenario presents a critical challenge for an EKG technician, accurately identifying ST segment deviations on an EKG tracing. Professional difficulty lies in the potential for misinterpretation, which can lead to delayed or incorrect medical interventions, directly impacting patient outcomes. ST elevation and depression are key indicators of myocardial ischemia or infarction, requiring immediate and precise recognition. The technician's role is to provide accurate data to the interpreting physician, and any deviation from best practice in this recognition process can have severe consequences. The pressure to perform this task accurately and efficiently in a clinical setting, often under time constraints, adds to the challenge. Correct approach analysis. The correct approach involves a systematic and evidence-based method for evaluating the ST segment. This includes comparing the ST segment to the PR segment or TP segment as the isoelectric baseline, assessing for consistent elevation or depression across contiguous leads, and considering the clinical context provided by the patient's symptoms and history. This methodical approach aligns with the principles of accurate EKG interpretation, as taught in certified EKG technician programs, and is implicitly supported by guidelines emphasizing the importance of precise data acquisition and preliminary assessment for diagnostic purposes. Adhering to established protocols ensures that the EKG data presented to the physician is reliable, facilitating timely and appropriate medical management, which is a core ethical and professional responsibility. Incorrect approaches analysis. One incorrect approach is to solely rely on visual estimation without a defined baseline. This is professionally unacceptable because it introduces subjectivity and increases the likelihood of misinterpreting subtle changes or artifacts as significant ST deviations. Regulatory frameworks for healthcare professionals emphasize objectivity and accuracy in diagnostic data, and this approach lacks the rigor required. Another incorrect approach is to focus only on ST deviation in a single lead without considering contiguous leads. Myocardial injury typically affects a region of the heart, manifesting as ST deviation in multiple, anatomically related leads. Ignoring this pattern can lead to overlooking significant pathology or misattributing localized changes. This failure to consider the broader EKG picture violates the principle of comprehensive data assessment, which is essential for accurate diagnosis and patient care. A third incorrect approach is to disregard the patient's reported symptoms when evaluating the EKG. While the EKG technician's primary role is technical, understanding the clinical context is crucial for recognizing the potential significance of EKG findings. Ignoring symptoms like chest pain or shortness of breath when observing ST deviations is a failure to exercise professional judgment and can lead to a critical delay in recognizing an acute cardiac event. This oversight can be considered an ethical lapse, as it prioritizes a purely technical task over the patient's immediate well-being. Professional reasoning. Professionals should approach EKG interpretation by first establishing a clear understanding of the isoelectric line, typically the PR segment or TP segment. Then, they must systematically examine the ST segment in each lead, looking for deviations from this baseline. Crucially, they must assess these deviations in the context of contiguous leads to identify patterns indicative of myocardial injury. Finally, they should always consider the patient's clinical presentation, as this provides vital context for interpreting the EKG findings. This multifaceted approach ensures accuracy, promotes effective communication with the interpreting physician, and ultimately prioritizes patient safety and optimal care. Question 20. Regulatory review indicates that a certified EKG technician is performing a resting EKG on a patient experiencing chest discomfort. The EKG tracing reveals ST segment depression in leads Roman II, Roman III, and a VF, accompanied by the patient reporting increased shortness of breath. Considering the anatomy and physiology of the cardiovascular system, which of the following interpretations of these findings is most critical for the technician to recognize and report? Option A. The ST segment depression indicates a problem with the EKG machine's calibration, requiring immediate recalibration. Option B. The ST segment depression in leads Roman II, Roman III, and a VF, in conjunction with the patient's symptoms, suggests potential ischemia or injury to the inferior wall of the myocardium. Option C. The ST segment depression is a normal physiological response to the stress of the EKG procedure itself. Option D. The ST segment depression is likely an artifact caused by patient movement during the EKG acquisition. The correct answer is B. The ST segment depression in leads Roman II, Roman III, and a VF, in conjunction with the patient's symptoms, suggests potential ischemia or injury to the inferior wall of the myocardium. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the EKG technician to interpret a patient's physiological response to a diagnostic procedure, linking observable EKG changes to underlying cardiac anatomy and physiology. The challenge lies in accurately identifying the significance of the observed EKG pattern in the context of the patient's specific condition and the expected physiological responses, ensuring patient safety and accurate diagnostic information. Correct approach analysis. The correct approach involves recognizing that ST segment depression in the inferior leads, particularly when accompanied by symptoms, can indicate myocardial ischemia or injury affecting the inferior wall of the heart. This understanding stems directly from the knowledge of cardiac anatomy, inferior wall supplied by coronary arteries, and physiology, how ischemia impacts myocardial electrical activity, leading to ST segment changes. This approach represents best professional practice by prioritizing accurate interpretation of EKG findings in relation to potential underlying pathology, which is crucial for timely and appropriate patient management as dictated by standard EKG technician protocols, and the scope of practice defined by relevant professional organizations and regulatory bodies governing healthcare professionals in the U.S. Incorrect approaches analysis. One incorrect approach would be to dismiss the ST segment depression as a normal variation without considering the patient's symptoms or the specific leads involved. This fails to adhere to the principle of thorough EKG interpretation and can lead to misdiagnoses, violating the ethical obligation to provide competent patient care and potentially contravening guidelines that mandate reporting significant EKG abnormalities. Another incorrect approach would be to immediately assume a critical event like a full myocardial infarction without further assessment or consideration of other potential causes of ST depression. While vigilance is important, premature definitive conclusions without a comprehensive understanding of the EKG pattern and patient context can lead to unnecessary alarm and potentially inappropriate interventions, deviating from the systematic diagnostic process expected of a certified EKG technician. A third incorrect approach would be to focus solely on the technical aspects of EKG lead placement and signal quality, ignoring the physiological interpretation of the waveform. While technical accuracy is foundational, it does not fulfill the technician's role in recognizing and reporting clinically significant findings, which is a core competency for patient safety and diagnostic accuracy. Professional reasoning. Professionals should approach EKG interpretation by first ensuring technical accuracy of the tracing. Subsequently, they must systematically analyze all EKG components, rate, rhythm, intervals, segments, and waveforms, in the context of the patient's clinical presentation, history, and any relevant interventions. This involves applying knowledge of cardiac anatomy and physiology to understand the electrical implications of various cardiac conditions. When significant deviations from normal are observed, especially those suggestive of ischemia or injury, the professional's duty is to accurately document and report these findings according to established protocols, facilitating timely medical evaluation and management.